Okay, so in today's session, what we will do is we will discuss some of the high yield topics which is important for your NeetPg. So I want you to note the important points that you don't know by now. So myself, Dr.Shivaam, and we will start with our first topic, that is neck dissection and their types. So we all know that Kreil was the first to describe the classical radical neck dissection. And if I ask you what is radical neck dissection, or simply what is neck dissection? So neck dissection in common term is also called cervical lymphadenectomy. So it is a surgical procedure for management of metastatic cervical lymphadenopathy, right? So there are different classification. The recent one is American Head and Neck Society. So they have given a classification out of which the different types are radical neck dissection, modified radical neck dissection, selective neck dissection, and extended radical neck dissection. So I have seen in recent year some of the questions from all of these. Like in 1 year they had asked what all lymph node you remove from supraomohyoid type of neck dissection. What is MRND type 3? So in very short we will try to discuss each of them and try to make you know what are these. So radical neck dissection involves removal of all the ipsilateral cervical lymph node from level 1 to 5 as well as the submandibular gland. So what we are doing in radical neck dissection, all the ipsilateral means of same side, means wherever the tumor is of that same side, we are removing the cervical lymph node from level 1, 2, 3, 4 and 5 and 3 key extranodal structures. So what are these 3 extranodal structure? Spinal accessory nerve 1, sternocleidomastoid 2 and IJV, that is internal jugular vein. So along with level 1, 2, 3, 4, 5, we are also removing spinal accessory nerve, sternocleidomastoid and internal jugular vein of the same side where the tumor is present. So this was the radical neck dissection. Now what is modified radical neck dissection? In modified radical neck dissection, as the name suggests, we have modified the procedure. What we have done is, now we are removing the level 1 to 5 as we were doing in classical radical neck dissection, but the difference is we are preserving one or more of the extranodal structures that we were removing in the radical neck dissection. So what were the extranodal structures that we were removing in radical neck dissection? These were spinal accessory, sternocleidomastoid and internal jugular vein. So based upon what type or what all things we are preserving, these are further divided into type 1, 2 and 3. Now if you ask me what all you preserve in different types of MRND, so in type 1 we are preserving spinal accessory nerve, in type 2 you are preserving spinal accessory nerve and internal jugular vein, and in type 3 you are preserving all the 3. That means type 3 you are preserving spinal accessory, internal jugular vein and sternocleidomastoid. I will repeat, in type 1 you are preserving nerve, that is spinal accessory nerve, because that is really important. You cannot sacrifice a nerve. So you are preserving in type 1 spinal accessory nerve. In type 2 you are preserving both the nerve as well as the vein, that is internal jugular vein. In type 3 you are preserving all the 3, nerve, vein and the sternocleidomastoid. So this type 3 is also called functional neck dissection, or what is done in case of different thyroid tumors. So functional neck dissection type 3 is sort of conservative neck dissection where we are preserving all the 3 extranodal tissue. Right, now coming to what is selective neck dissection. So selective neck dissection involves removal of some but not all the lymph node group. In radical neck dissection, if you remember, we were removing all the 1, 2, 3, 4, 5 lymph nodes. But if you have some tumor for which you only need to remove some lymph node, so there are different selective neck dissection for those tumor. Like in many tongue carcinoma or oral cancers, where the tumor is only located on one side, we do supraomohyoid neck dissection. Now, what do you mean by supraomohyoid? In your question, you got a question in the examination where they asked what all lymph node you remove in supraomohyoid neck dissection. So we remove level 1, 2, 3. 1, 2, 3 is supraomohyoid. Now you can note it down. Supraomohyoid is level 1, 2, 3. What is posterolateral selective neck dissection? If you remove level 2 to 5, suboccipital and postauricular. So posterolateral is level 2, 3, 4, 5. What is lateral? Lateral is only level 2, 3, 4 or the jugular group of lymph node. What is anterior or central that you do in case of papillary carcinoma thyroid? It is level 6. So anterior or central is only removal of 6. Now if you ask me which all are very important for you, supraomohyoid is must for you to know, level 1, 2, 3. Anterior or central is must for you to know, which is level 6, right? So these were your selective neck dissection. Now in the initial part I discussed extended radical neck dissection. Now you know what is radical neck dissection. In external radical neck dissection, we are removing all the things that we were removing in the radical neck dissection. That means we are removing level 1 to 5, that is 1, 2, 3, 4, 5 cervical lymph node along with the spinal accessory sternocleidomastoid and IJV. But what we are doing extra? That this is called extended radical neck dissection. We are removing one or more additional lymph node groups or some non-lymphatic structure. So if you ask me what all non-lymphatic structures, these are suboccipital nodes, retropharyngeal nodes, parotid nodes, facial nodes, level 6, that is paratracheal Delphian perithyroid node. Now note that level 6 was not removed in normal radical neck dissection or in modified radical neck dissection. So if you are removing level 6 also with these, it will be called a extended radical neck dissection. So they can ask you in examination that which group of lymph node are not removed in modified radical neck dissection, and they will mention level 1, 2, 3 and 6. So 6 is not removed in normally, but in extended radical, level 6 or paratracheal Delphian node or perithyroid nodes are also removed, and some non-lymphatic structures like carotid artery, hypoglossal nerve, vagus nerve, paraspinal muscle may also be removed in extended radical neck dissection, right? So this was the most important things that you have to know about neck dissection. Now coming to the most important topic, or you can say the most asked topic from surgery, that is salivary gland tumor. So you can expect 2 to 3 questions from this topic. So the general question that they ask, first we will try to discuss them, like what is the most common neoplasm overall. So it is pleomorphic adenoma. So most common neoplasm or most common salivary gland tumor is pleomorphic adenoma. Now what is most common malignant neoplasm? So it is mucoepidermoid carcinoma. Most common radiation induced malignancy, it is mucoepidermoid carcinoma. Now point to note here is you not only need to know I am telling you most common, because nowadays they are less asking you most common. What they will do is they will give you a clinical scenario where they will say that your patient has presented with a parotid swelling and patient had a history of repeated radiation exposure. So you have to understand that they are giving you hint that